EECP, Enhanced External Counterpulsation. It's also called as Circulation Enhancement Therapy. It is a very simple and most effective treatment method. Here, the patient is made to lie down in a couch or a bed, and his lower part of the body, especially the lower limbs up to the abdomen, lower part of the abdomen is tied with a cuff like the blood pressure cuff, and is attached to a computer which, in sync with the heart rate, produces contraction into the body by creating compression by sending in air into the cuffs, and which leads on to compression of the lower part of the body, which squeezes the blood into the upper part of the body as well as into the internal organs. So what happens is, most of the diseases are because of deficiency in the circulation of the blood, which indirectly creates lesser oxygen to the target organs, which leads on to degenerative changes. In this system, there is no surgery, no medicine, nothing is involved. All you have to do is the patient has to lie down, and in synchronization with the heartbeat, when the machine pumps, when the heart is in a diastolic mode, that is in the relaxation mode, the machine pumps. When the heart is in a contraction mode, the machine relaxes. So when there is a relaxation of the heart happens, the blood flow is going back into the heart. This is being aided by the machine's compression or squeezing, thereby more blood is sent into the brain and into the rest of the parts of the body and including internal organs. So this gives more circulatory as well as oxygenation to the tissues as well as to the internal organs, creating enormous amount of oxygenation and rejuvenation to the cells and the tissues. It's extremely effective for all chronic diseases, in conditions of the heart, in conditions of the brain, in conditions of the internal organs like kidney, liver, pancreas, and especially in conditions like diabetes, hypertension and all. But the best of all is it helps in increasing the coronary blood circulation. This pumping squeezes in blood into the arteries that supply the blood to the heart, thereby creating enormous amount of collaterals to open up and supply the myocardium with enough oxygen and enough blood supply. By doing this, we can prevent any heart related events in the future, especially the commonest killer in the modern day, which is called as a myocardial infarction or coronary artery disease. You all know that in the modern world, stress and improper lifestyle, especially the food, bad sleeping habits and all these things, create enormous amount of toxic load. It produces thickening of the arteries, and many things like the food what we take in creates lot of toxic load, and especially the exposure to the air outside, that is the smoke, which contains a lot of lead, and smoking, which contains cadmium, and the water we drink, which contains lead, and so many other lot of heavy metals which are pumped into our system, which create enormous amount of inflammation into the vascular tree. This vascular tree inflammation, or what we call as endothelial inflammation, lead on to thickening of the arteries, thereby reducing the blood supply to the target organs. By doing the circulatory therapy, especially the EECP, what we call as pumping system or squeezing the body, all the closed arteries open up, and it can be done also for preventing the bypass surgery also. And for people who have compromised health, who cannot undergo surgery, this will be the best solution for them and safest FDA approved system. So this is one of the best system and a boon to curing many of the diseases.